Hi, happy Wednesday, and welcome to the webinar, Wellness Dentistry. The future of dentistry is here. In this webinar, we will learn what is wellness dentistry and what patients are looking for. We're also learning wellness dentistry techniques and procedure you must know. Regardless if you're doing this or not, it's helpful to know so you can talk to a patient. And of course, when you know all about the techniques and procedure, you want to start a journey of wellness dentistry today, and you want to know how. So let's dive right in the webinar today. And I know many of you attending, I heard of 1,600 of you attending this webinar today on wellness dentistry, and many of you asking, what is wellness dentistry? Well, wellness dentistry is dentistry concerned with the whole body effects of all the dental materials, techniques, and procedures. That's the book definition. In our office, to sum it up for the patient, we tell them that it's confident smile for healthy life. You cannot have a healthy body without a healthy mouth. And whenever I see a new patient in our practice, I share with them 3 philosophies that I practice in every day. Number 1, patient is individual, and personalized treatment is designed for them. So each patient will have different treatment plan. That's why we call personalized care. Number 2, patient had to be the hero of their own health journey. The dentist and the healthcare providers are the guide of that journey. So patients are taking the ownership of that journey. And number 3, we like to keep as many healthy teeth as possible. So for us, less is more, less dentistry, more teeth you can keep. But if you end up needing dentistry so you can keep more of your teeth, then we want that dentistry to last a long time. So those are the philosophy that I share with patients daily in our practice. But sum it up, confident smile for healthy life. But first, I want to clarify some myth and some information out there about wellness dentistry, because number 1, wellness dentistry is good dentistry. Just like the definition is actually more like a whole body dentistry, and it's definitely not a get rich quick scheme like a lot of people talk about on social media, because when you get to know the patient, you know you're treating the whole body. And of course, I'm so glad you're here because you don't know what you don't know, and you are so open to attend this webinar to know more about wellness dentistry. And definitely your result are the implementation outcome that you do in the practice with your team. So I know many of you can relate to this because I hear that all the time when I'm on the lecture circus or going on different conference and seminars. People say that they feel like they're on hamster wheel, working way too hard in their business and feeling burnout, because being a dentist, you're a clinical person, director, you're a business manager, you're also the CEO of the practice. And so you also find yourself wondering, gosh, this year is so tough because a lot of practice struggling with new patients. They don't know where the next new patients will come from. Then, of course, since COVID, we talk about team turnover, unmotivated employee, and how we can keep the team and not keep spending time and money on training new team members. And of course, when you hear about, especially if you are participating in insurance plan, you feel that you're undercharging, but especially with inflation rate these days, you're not getting paid enough for what you're truly worth, because you go to school for so long to be able to help the patient, employ so many people, and not getting paid at the end of the day. And of course, with social media, you feel like everyone else in dentistry doing so well, they make the kind of income that you want, but you have no idea how they do it, like how they become fee for service and not have an empty schedule. So the good news is you can solve all of those problems with wellness dentistry. At least I did, and hundreds of others, dentists that practicing wellness dentistry and learning and coaching with us. So hi, I'm Dr. Katie To. I talk about wellness dentistry for a bit. I'm a owner and founder of Dr. Katie To Dental Wellness Center right here in Katy, Texas. I am the Master of Biological Dentistry, also the Master of Digital Smile Design, Certified High Performance Coach, and also the owner founder of Katie Dental Seminars, focused on cosmetic dentistry with composite. And we do have a Wellness Dentist Institute where we're teaching wellness dentistry for dentists and team members. We do coach multiple wellness practices around the country, but my number one job is being wife and mother to Apple and Bailey. And we love eating and traveling when we have free time. Well, the number one reason that you should consider wellness dentistry is patients are looking for wellness dentists. If I can show you the statistic of the amount of new patient requests and phone call in our practice right now, at this moment in December of 2023, we have about 4.5 months wait list for new patient. Trust me, I don't like that statistic. I would love to get patient in sooner, but people are looking for wellness dentists. They're willing to wait 3-4 months to get in because they know wellness dentists are able to help them. Why? Because wellness dentists understand mouth and body connection. Wellness dentists offer wellness procedure, and we talk about that in a little bit. And of course, patient willing to pay for what best for their health. Especially after the pandemic, we understand that why someone get affected with COVID and someone did not, because of their immune system, because we all have a different health conditions and genetic and stress level and nutrition. So of course, patients understand, if the wellness dentist understand the mouth-body connection and offer wellness procedure, they're willing to come, they're willing to pay, and they're willing to wait. So on our practice, we got listed in professional website like IABDM, which is standing for International Academy of Biological Dentistry and Medicine. And when we're listed on there, people calling our numbers, our office number. And in our practice, you have to go through an interview questions to get into the practice, so we make sure that we are selective the right patient. And we also listed on the IAOMT, which is the International Academy of Oral Medicines and Toxicology. So when you're listing on these websites, these are the website that working, educating the public about wellness dentistry, and they get our database and our number from there. And not just patients are looking for wellness dentists, medical professionals are also looking for wellness dentists. I was totally surprised when I'm sharing the wellness dentistry on stage with medical professional, because they actually did not get a lot of dental education training in medical school. And we have a lot of people come up and asking, how can I find dentists that understand the mouth-body connection, that help me to receive my patient and to treat my patient that I'm treating in medical practice right now. So Dr. Chang Ruan is one of the very famous and huge advocate for oral mouth connections. He's have a private practice here in functional medicine in Houston, with a pretty big group practice with multiple doctors, over 9 nurse practitioners, and lots of health coaches to help patients to get better. And I was invited to share about dental brain connections at one of his seminars. And at the seminars, all MDs. At the end of the seminars, the medical doctor came up to me and asked about how can I help them to find like-minded dentists so they can send patients to. So I'm telling you that medical community need us. We are not inferior compared to medical doctor. And a lot of us asking permission for procedure, or asking them to see if we can see the patients for this and that. In wellness dentistry, we are equal. They a lot of time getting our permission to go move forward, because as the airway health and wellness dentistry, we actually a key player in how to get patient healthier. They cannot get the patient healthier without a dentist on their team. So let's talk about what the wellness dentistry techniques and procedure that both patients and medical professionals are looking for. First of all, our practice is mercury-free practice, which means we don't place mercury in daily procedure. We also mercury safe. Mercury-free and mercury safe are not the same. Mercury-free means you don't place it. Mercury safe means you remove it safely. So you can see, looking more into the technique and the requirement, both IMT and IBDM having the protocol listed on their website. But pretty much it's not just safe for the patient, but it's also safe for you, for your team, and for the environment. Remember, July 2020, every single dental office by federal law had to have the mercury separator in their practice. Do we ever question why they control that mercury level coming out of your practice to the water system, but no one ever questioning about where those mercury and particle coming out from the mouth? So this is one of the example of cases when we do in the office, we always taking the before picture, we isolate the patient just like this pictures, and then in the mouth, we isolate the tooth, one clean rubber dam for each single tooth. And we're also taking x-ray after the mercury removed to make sure we get every little particle out, and then restore the tooth in a biomimetic way, which is reserve tooth structure as much as possible. And we always showing this to patient. We sending this documentation to the medical office that refer the patient to us. And that's the reason why medical community understand what we do and why we do and how we do it. Personal story, go back a bit. In 5 years ago, in 2018, I got really sick, was suspected with autoimmune, suspected with a lot of different medical conditions that I'm like, I know I don't have it. I know something mysterious going on. And until one of the functional physician in Houston asking the question about mercury exposure, then when my test come back is such a high level of lead and mercury, and I have 0 mercury filling in my mouth. And the conclusion was occupational exposure from removing those mercury day in, day out. And so not everyone getting the same issues with the mercury exposure. However, you don't know your DNA, you don't know your methylation system, you don't know how your body reacting to it. And the best way for that is take care of you. The same is number one philosophy we share with patients. We are all unique individual. And so if this is what make me sick, it could make a lot of people sick. And the best way is just protect not only the environment, but the patient, yourself, and your team. And I'm so thankful because my team are on board. They support wholeheartedly and practice the way that we believe in wellness dentistry every day. Another procedure and technique that patients looking for in wellness dentistry is dental ozone therapy. More and more that you hear about ozone therapy in medicines and dentistry, especially if you look in a lot of water bottle. Ozonations is using to disinfecting, and ozone are using in a lot of big industry. However, in medicine, there's not a lot of implementation because there's lack of training and not a lot of information. Even though if you go to PubMed, there's tons of articles talk about dental ozone therapy and ozone in medicine. So in our practice, we use ozone for restorative procedure, perio procedure, for surgery, and of course, if practice that using doing endodontic procedure, they're also using ozone for disinfection. And you can see one of the case here where the cavity is getting quite deep, closer to the pulp. Actually, the patient was told to have root canals evaluated. Some of the dentists even recommend root canals on this tooth, but we're able to protect and restore the tooth using ozone. And the before and after picture, the only difference is ozone application. And that turning the affected dentin calcified it, then you can pick up your slow speed handpiece, cleaning as much as you can without penetrate or invaded the pupil space. And even in our practice, we actually prescribe ozonated oil, which means the ozone infused into organic oil to maintain that ozone particle. And so they use it to put on the surgery site. So when we do tongue tie release, people can using ozonated oil to stretching the tongue. They can use this as a post-perio procedure, post-extraction, and is using organic oil and ozone, so it's very pure, and you can put it in the refrigerator to last a long time. Another differentiations, especially in periodontal assessments, in wellness dentistry, we use phase contrast microscope, and maybe in dental school, we don't have exposure to phase contrast microscope, but I have talked to so many hygienists these days, and their educational program have this as a part of the education. So a lot of the hygienists that you hire actually know what phase contrast microscopes is about in their program, and they use it in hygiene school. So traditional periodontal evaluation, you will see we talk about bleeding and probing. We talk about recession. We talk about mobility, furcation. Really nothing more than a damage report. We talk to patients all this big term that people are not connected or understand what that means. It's not a risk factor base. So by the time that the patient hear this from our team or from us, it's a disease model. They already got the disease. They're not motivated. They're not committed to do perio treatment. And because of that, there's no home care or consistent follow-up, and there's no improvement. This is what the majority of what perio in private practice look like. So with the phase contrast microscope, you actually can show patients what's in their mouth. If they see what's in their mouth, I guarantee you the motivations is a lot higher, and they are willing to do whatever it takes to get rid of that high-risk pathogens that's swimming and super active in their mouth, in their saliva. And so in our practice, when patients come in, regardless, is it a new patient, is it a patient on 6 months recare appointment, or even a consult. People come in for a cosmetic consult or come in for a limited exam. Every single patient, just like we're taking blood pressure in every single visit, at every single visit, we're taking slide at every single visit. Then we're giving them a microscope exam report with low risk, moderate risk, and high risk. We circle and highlight what we see on the slide, and then let the patient know what home care and action that they need to take to get that under control if they committed to it. By the way, this is the patient health and this their mouth. Our job is a guide. They're the hero. We prescribe and tell them what's working and let them decide and commit it to that program. Besides that, knowing on the microscope that this is the low, moderate, high risk pathogen, we want to know what they are and how high the level is in the mouth. And we want to have a baseline, which is when they come in, what they look like, after they're doing the home care and the treatment in the office, in 30 days, what they look like, in 60 days, in 90 days, 120 days, what they look like, and how I can send this report to the medical doctor. And so they can understand that the patient actually either have issues with the immune system, that the immune system could not take over, or they have some other underlying issue with their gut because the mouth is beginning of the gut, or they having issues with an active infection that the 2D images doesn't show on their exam at your dental office. All of that information is helpful when we're testing. Therefore, the high-risk pathogen test called HR5 by Direct Diagnostic is our go-to because of the cost. Is affordable for patients to test frequently, and we can share the report with the level of the bacteria and the pathogens and the name of the pathogen and how it's associated with the systemic and health risk. And of course, when you find out that the patient have all these issues, right? The saliva that have a lot of pathogens, and the saliva test confirm that. We using the guided biofilm therapy, one of the part of the treatment, beside the dental ozone therapy, the laser therapy, we also use it guided biofilm therapy to help eliminate the biofilm and the pathogen. And of course, follow-up testing would tell us that if the patient respond well to the treatment. So remember, the traditional periodontal assessments and treatments are very disease focused. However, in wellness dentistry, we want to focus in health model, which means we screen with microscope, we test saliva, and we come up with the personalized game plan for the patient. And nothing is powerful than seeing what's going on in the mouth, and patient actually excited about getting the slide check every visit that they come in. One of the wellness procedure that we use in the office is also the medical grade centrifuge that we make the platelet-rich fibrin. We also use this PRF imperial procedure to help regenerate soft tissues and bone. And we, especially in surgical like extraction, we using a lot of platelet-rich fibrin, and patients actually looking for provider that doing this because they know their own cells will support them in healing much better than just put in the graft from another person. Anything that coming from your own body and highly concentrated in healing and regeneration, definitely patient looking for that option these days. And this is what it looked like when it's coming out of the centrifuge. And you can use it to pack it in the socket. You can use it as assisting in one of the grafting. And just like I mentioned, the liquid from the PRF can also using to inject into the gums and help healing, swelling, and regeneration. And wellness dentists also talk about nutrition and hydration and supplementation. And more than anything, not just preaching about it, you also have to walk the talk. So we talk about what we're looking for in patient nutrition. We want to make sure people are understanding inflammation food are high in sugar. Also dairy are high inflammation, especially dairy that not grass-fed or not organic. And then also gluten, because some patients are highly sensitive to it and therefore causing a lot of other symptoms and issues in the system. So we're not trying to be nutritionists in the practice. However, we do have nutritionists to refer to, but we always mention about dairy, sugar, and gluten to our patient, amount of hydration, which is how much water they drink, and what supplementing they take to help with the immune system, like vitamin D level, vitamin C, B12, and asking them to get that testing from their physician. Now, we're also showing this book in the practice. We have it in the operatory. We have it around the office. We want patients to understand that going to the dentist once every 6 months or 3 months or whatever that frequency is not enough to get healthier. They got to commit it to the health journey. They got to educate themselves. We encourage patients to read books. We encourage patients to share with us what working for them and what holding them back. So books is a great way to communicate with patient. And same with medical doctor. We actually, a couple years ago, we give all our medical referral the book called Tongue Tie by Dr. Baxter. And they actually love it because they don't get that exposure in medical school. In wellness practice, we love to show the gold standard in radiologies is the cone beam CT. So patient that having root canal, which we cannot see everything in a PA or a bi-wings or a panel, we encourage patient and prescribe a cone beam CT to make sure we don't miss out on lesion that just so close to the brain, and that a lot of medical professional are find out about this lesion when the patient end up with a heart attack and a stroke, and they realize that that's what's sitting there for so long. And whenever you get a cone beam CT on the patient, please send it out to a radiologist to have that red. In our practice, we send every single scan to the beam, to a radiologist in a beam reader. And if we take a 2D x-ray, we're using Pearl AI in our imaging software, so we can having a good calibrations across the board. We have the patient involved. Is this caries in dentin? This caries only in enamel, where you can reverse it and heal it, and changing your diet and stop drinking that soda. Patients have to see it to be motivated, to be able to take charge. And so since we're implementing the AI and have the radiology report whenever they get a cone beam CT, we be able to share this report with their medical professional. So we always asking patient, if we do a sleep test, we want to send a copy to the physician. If we have a radiology report, we want to send it to their physician. We want to make sure the physician know we are not just a tooth mechanic. We are the doctor of the mouth. And if we are taking any tooth out of the mouth, just like the tooth is an organ. If you remember in dental school, we talk about the definition of an organ. An organ have limb, have blood vessel, have nerve, and have function. So every single tooth in the mouth is an organ. It's qualified as a definition of an organ. So if we're taking a tooth out, please consider testing to see what's inside the tooth. Because the simple rule is, if it's inside your tooth, it's inside your body. And I never have a physician ignore this report. When we take the tooth out, we send it in for PCR testing. They test for 88 different pathogens. And the report come back red, mean high risk. We send the report to the medical professional, and they take care of it. The good news is, we as a dentist need to do procedure, test it, and send it to the medical professional for them to take care of the body. And Wellness Dentistry doing a lot of laser therapy, especially in our practice. We have the Photona, which is very powerful. It's a soft and hard tissue laser. So what function do we do with Photona? We're doing biomodulation, which is help healing. So we do biomodulation for TMJ disorder. We do biomodulations before we're taking the CR bite. We do biomodulation after the surgery, and also post-op healing. And also we're using the hard tissue laser therapy for bone regeneration in perio procedure. So patients actually don't want to lose teeth. They rather trying to save their teeth and changing their home care and their nutrition and working on it to get a second chance, because teeth don't grow back. The more implant that we see, the more that we know implant are not teeth. They not replace teeth. They are better than not having teeth, but they're not as good as the real teeth. So Wellness Dentistry love technology, you can tell. We have a lot of toys, we have a lot of technology in the office, but one of the big things about Wellness Dentistry is we don't just check the bite with the bite paper or articulating paper. We check the bite with the T-scan system, so we can, again, show patients how's their bite look like before and after adjustment. And if you can do a T-scan on every single new patient that come in your office, I promise you, they no longer blaming you for you changing their bite after a filling or a crown. Because first of all, we have the record and the baseline of the bite look like. And on top of it, we're doing dentistry responsibly by make sure that we are not changing the bite. We are not creating more trauma by occlusal changing because of the dentistries and the crown that we're doing every day. And of course, when you talk about wellness, we said the definition is confident, smile, a healthy life. We talk about how to get the patient healthy with technique and procedure. But the big part of wellness dentistry is actually give the patient that confident smile back. So we always start with the end in mind. That's another philosophy that we strongly believe in practicing every day in wellness dentistry. So if the patient come in and have missing teeth or need a treatment plan, any new patient, we are designing them like an ideal treatment plan. Do I present every single ideal treatment plan? Of course, not presenting, because the patient had to commit it or at least aware or interested in the procedure. So if patients have congenital missing teeth, they're growing, they need the guidance, they have the age, right, limitation, then what can we do? Show the patient what the possibility, what you have in mind, start with the end in mind, and then they going and get to implementing that. So you can see the patient actually getting what we're showing them and be able to really coordinate between the orthodontist, between the periodontist in this case, and we can give patient the most natural looking smiles possible. And again, seeing is believing. The patient can come in for saying on this case, Nick come in and say, can you shorten my canine? Number 11 drive him crazy because he didn't like the way it looked. It looked like a fang and he wanted me to shorten that tooth down. Well, I'm glad I didn't agree to that because, again, every new patient, we start with the smile design. And here it is with Nick showing what he have lost and what he's supposed to have at his age as function, aesthetic, longevity. And so wellness dentistry are not just waiting for patient to break a tooth and do a crown. We don't wait until patient asking for help and say, oh my gosh, I'm losing my teeth. What's going on? I don't want to be like my parents. I don't want to have denture. Well, in order to prevent that, we need patient to be on board. We need to understand what have happened in the past and how we can prevent that in the future. So treatment plan for Nick, not simply just go ahead and lengthen the teeth with veneers. We didn't do that because his wish is to want to keep on his natural teeth. A case like Nick, we start out with periodontal assessment. Nick had his slide done. Nick has got saliva testing. He then getting to make sure that no active disease of cavities going on. And then he saw the orthodontist for the next 18 months. The orthodontist aligned the bite, and in order for me to go ahead and do composite bonding on his teeth so we can save the enamel and the tooth structure, because Nick in his late 30s, he still have a long way ahead of him, and he already lost that much enamel. So if we can help him not only getting the bacteria down, the home care established before investing further into orthodontic treatments and composite bonding, we want to establish that. And because we be able to show Nick what he's going to look like at the test drive, at the visit of presenting the smile design, Nick confidently knowing that we be able to deliver that. And that he would go into periodontal treatment and orthodontic treatment, knowing that this is what needs to be done to get to the final smile. So a lot of time we struggle with get the patient to say yes to perio treatment when they come in for a cosmetic procedure. It's because we making the patient feel like the periodontal treatment or even moving teeth with orthodontic treatment like braces were Invisalign, like a barrier to their desire goal, which is the new smile. If we can make them see it for themselves, look, you have a lot of bacteria going on in there, lots of inflammation, just saliva test coming back indicating high risk, especially for cardiovascular, Alzheimer, then they have the motivations to treat that first. Because who want to invest in a new smile and then end up losing the teeth to periodontal disease, right? And before we put the patient into orthodontic treatment, aren't they had to have an established home care and a healthy mouth before you put them into more movements and intentional minor trauma when moving teeth? And so in a lot of practice, we're skipping step because the patients say no. In wellness dentistry, the periodontal treatment, the orthodontic treatments are just a step for them to get to where they want to go. And I think that with proper explanations and educations from our part, patient would say, nobody ever told me about that. Nick had dentists all his life. He had no cavity. Cavity is not his problem. He's concerned about tooth number 11. And not a single dentist before he came to our office explained to him why that happened to him. So as a Wellness Dentistry, we bring everything together, right? We understand that in order to have a healthy smile, you had to have a healthy mouth first. Watch out for bacteria, pathogen level. Then how did you get here in your late 30s? What happened? What happened to your bite? What happened to your sleep? And by the way, Nick, as a part of his evaluation, he had sleep study done. He had moderate sleep apnea. That's why he clenching and grinding on anterior teeth to really alleviate and compensating for his airway. So again, we're not only looking at cavities and gum disease with bone loss already happening, we be able to bring the patient to wellness in their late 30s and not have to take teeth out and do implant and do even possible talking about denture in their late 50s or 60s or 70s. So the outcome and the result that we're talking about is big in terms of just not one patient, but Nick actually talked about how we treatment plan and how we're taking care of him. He sent patient to us. We'd be able to help his family members, which is his wife and his kid. So the ripple effect of wellness dentistry is huge because we are bringing everything together. And so for me, I love this picture because seeing is believing, right? He's in his late 30s, would never agree to orthodontic treatments and bonding until he see this picture. And he doesn't want the teeth keep getting shorter, and he doesn't want to lose his teeth. So the top 10 thing that you don't know really about wellness dentistry based on the conversation we have so far is patients are looking for wellness dentists. Well, you can see that based on even just go on social media and how many people are saying, where do I find these dentists that understand the oral and the body, the mouth-body connection? And even medical professionals are looking for wellness dentists. I know ENT need dentists to help with appliance, but they don't just look for appliance. They're looking for dentists that understand, even offer night lace for snoring, even offer myofunctional therapy for the tongue, retraining the muscle of the tongue. They also looking for dentists that know or understand about tongue tie release to help with the airway. So you're thinking about medical professional, they cannot do all that procedure. They need us. And as a wellness dentist, you have a journey. You can learn to how identify symptoms and issues. Then you can know how to classify it. Okay, is it a stage 1, class 1, grade 1, or 2 or 4 or 3, right? And then after you understand that, you can decide to know how to stabilize it. Like, for example, Nick, if I don't know how to treat that case, I can at least put Nick into an appliance. If I know about sleep study, I would order one and get him at least seeing an ENT and either trying the CPAP or an oral appliance to manage the condition. Not really cure sleep apnea with CPAPs or appliance, but I can manage it. He actually get more oxygen than not having anything in the mouth at all. And wellness dentistry actually is super low cost to start because you actually can start today. And if it's already 7 o'clock at night, you can start tomorrow. And for me, my number one advice is starting wellness dentistry is asking questions, asking about the sleep quality, asking about their nutrition, asking about their hydration. Yes, we do ask about their bowel movement. If your patients are not having regular bowel movement, their mouth is super acidic, and please, they're going to blame everyone else for their cavity because they don't know why. Sometimes patients blaming other people for cavities. When we hear a mom say, oh, I get cavity when I get pregnant, or, oh, I get cavity because my genetic, it's because they don't understand why they had cavities. But if they understand and they have chance to improving that, then you the one that changing the world for them because they try everything or they don't know why it's happened. And think about our patient having children. Now your influence and not just stop with the patient. It's extended to their family, extend to the community. And that alone, for me, is enough reason for you to implement wellness dentistry in your practice. It's really high return on investment because you're doing extra procedure, you're doing things that not many dentists offering right now. So patients gonna light up and trying to get into your practice as a patient. Therefore, you don't have to accepting insurance plan. Our practice is fee for service. We setting our fee based on our unit of time, not on what insurance company or what the zip code say you can charge. So when you're practicing based on the value of your time, you feel appreciated. You know that a class 2 on a mesial number 15 take longer than a class 2 on number 12, right? So you actually build the procedure based on your times and the expertise and the difficulty of the case, and not because the insurance say this is how much you can charge. And you can build a stable team. The cool thing about wellness dentistry is when the team understand and practice it, they not want to go anywhere else. They not want to practice somewhere that not provide an environment for the wellness, because again, the ripple effect, when they understand the wellness dentistry and the wellness overall with the healthy mouth, healthy body, they also implement that at their own home. Therefore, they walk the talk, just like you walk the talk. They also, patient understand that, yes, this team is not only talk about it, they walk that talk. They also implement it on their children and their family. And they don't want to go somewhere else that didn't have the same philosophy. So I'm so proud that we have a stable team, and the team doing amazing connecting the patients and get the patient on understand that it's not easy to have a healthy lifestyle, but it's possible. It's possible because that their commitment. And if the patient don't want it to have a healthy life, and that's okay, because we as a healthcare provider cannot want it more than they do, because that's going to lead to compassion fatigue. That's when we get tired because they don't do things and things break down and they blame the dentist. And so now we feel unappreciated. We feel that life is not fair. We feel like dentistry is so hard. And of course, when you're having full schedule, you practice based on the value of your time, you have healthy profit. And right now, I can tell you in so many markets, there's no competition. We have patients flying in last week from Nebraska. And the week before, we have patients coming all the way from Seattle. And I'm sure, oh my God, Seattle have so many amazing dentists, right? Same with Nebraska. But how come they cannot find anyone practicing wellness dentistry that they can trust and come in and doing the procedure? And of course, I said over and over again, you can start now. You don't have to spend money to buy cool toys and doing comprehensive or crazy procedure. You can start now by asking questions, by changing and adding questions to your exam, to your hygiene exam, to your new patient exam. We actually having a very efficient and comprehensive way to do the exam that patient always say, I never have an exam like that. And it's really simple to do. It doesn't take hours of your time. You do need help from the dental team to help you to collect the data, like the x-rays, the photos, the SDL scan from the intraoral scanner, things that you are probably doing it anyway, but how do you talk to the patients and how you tie things together that let the patient know you practice wellness, that you are different from other dentists, that you care. I know that you care, but the patient had to know that you care, and the patient know that you're different, that the patient know that you practice wellness dentistry and not just a tooth mechanic. And we talk about wellness dentistry and what patient looking for. We talk about wellness dentistry techniques and procedure you must know. And I know a lot of you would like, how do I start that, Katie? And I said already, you can start it in your practice with the new patient exam, asking the question. You can start that with your hygiene exam. You can understand that the sooner you start, the faster you get there, because there's nothing is easy. Staying in network with insurance is not easy. It's get harder every day, actually. Going fee for service is not easy if you don't have a strategy and you don't have any value to offer your patient, because people these days with inflation, especially, very savvy. If you are doing the same cleaning, the same exam to the one that in network, there's no reason for people to stay. So you have to pick your heart. You have to choose your heart. Stay in network, stay out of network, doing mediocre dentistry, doing high-level dentistry, doing the single tooth dentistry, or doing the wellness dentistry. And of course, you can start the wellness journey with the master class. I have a lot of these questions. How do we study and how we learn about this? And of course, we always start with new patient, ozone therapy, nutrition, microscope, and perio, then mercury removal, and of course, the smile design. And so I know that a lot of you having questions. I'll take the time to answer the questions. And please stay connected. This is my social media, and you can email me from there, DM me from there, and let's go ahead and go straight to our Q&A questions. Yes, the question said, how do you charge patient for the report? We do not charge patient for the report. We actually create the report ourselves, and we print it out, and every time we have a slide on the microscope, we circle. We actually have it on the microscope having an extended screen. It's a medical graded screen, and it's showing up what we see on the microscope, showing up on the screen. And so we're showing them what a spiral kit look like, what amoeba look like, what a spinning rod look like. And if they show up on their slide, we circle that on the report and send it home with them. So we don't charge the patient for report. The saliva test, we do charge because it costs us to send the test to Direct Diagnostic for the HR5 saliva. And the test is $99 for every time the patient's spitting into the test tube and send it in. So that's the one cost that we charge the patient for saliva testing. The question about what is ozone therapy? Well, ozone therapy is based on the oxygen molecule. Instead of O2, it's O3. I know we should learn this in dental school. And now here we are learning it on CE and dive deep into it. And O3 extremely highly oxidative, and it's bactericidal, and it's also kill viral and fungal, and is very effective. In fact, in medicine, they're using ozone for treatment of a lot of cancer and Lyme disease, autoimmune disease. So in dentistry, we're using strictly for restorative procedure to disinfecting the prep. Desensitizing is very effective. When we have the microscope, ozone demonstrated on every single team members and patient that we're showing them why ozone effective. So we can take a sample of the slide, say in the pocket of the molar area, put it on the slide. You can see the bacteria and the pathogens swimming like crazy. Then we treat that pocket with ozone, take another sample, put on the microscope, and there you are, the slide is clean. And so we know the ozone is highly effective, and actually ozone used very widely in huge industry for disinfection and sterilization. And that a lot of your air filter machine have ozone in it. Can wellness dentistry be applied to kids? Oh my God, actually it's very big because parents, I'm having 2 young kids, and I can tell you, we do anything for our children because a lot of us realize we have premolar taking out for ortho. We realize we have tongue tie. We realize we have a lot of things that we wish our parents would do differently or have an opportunity to improve it. Now with kid, big things about airway. We look at the tonsil side. We look at the Mallampati score. We look at the nasal breathing in the exam. We look at so many information that pediatrician missing out. And, as I said, we are not inferior compared to our medical professional. We actually equal, or in some area, we actually guiding them. I wrote letter to pediatrician all the time about why this kid needs to see ENT and why this kid needs sleep test. And so as a dentist, especially if you are seeing kids, you have ability to change someone's life trajectory. If you understand that they're not breathing, they're not sleeping, they don't really have ADHD, they're just screaming for help because they could not sleep. And they cannot grow because they don't have growth hormone release when they're sleeping. So yes, wellness dentistry is 100% applied to kids, and we're having a little bit different sheet when we're doing the wellness exam on new patient that's a kid compared to an adult. In kid, you have time to change that, and anything that you can do in kid, the result is amazing, like expander and myofunctional therapy and nutritional. A lot of that can you see the result in turning. We actually see kid with huge tonsil, like a grade 3, changing nutrition, mouth taping, nasal rinsing, and the tonsil shrinking. So you can definitely do that. What do you charge to remove amalgam? Yes, we do have a fee for amalgam removal because every single tooth requires a separate rubber dam that you have an extra time, you have an extra, I would say, PPE protection. You can't get out of the room when you remove the amalgam. So we are charging extra $250 per tooth to compensate for the supplies and the extra time that we spend to protect the patients and environment and ourselves. Which lab do I send the mercury and the lead test? I do draw my own blood, yes. In the state of Texas, we have medical director, which we do. Then your team member can draw that as long as you have a medical director. But I do my own blood drawing when I'm doing surgery. Actually, in every state, you can request to get your mercury test done. There's a test called Tri-Mercury test. It's from Quicksilver. The company is actually a medical company called Quicksilver, and they offer a test, the Tri-Mercury test, which is hair, urine, and blood. And you can actually get a hair sample closest to your scalp and send it in, and they can give you the information. Now, that is a test that did not trigger the mercury. So there's a different way for them to testing. They can provoke your system to release the mercury to know how much you have, or you can see it from your existing hair, urine, and blood. So you have to talk to a functional doctor, and they explain all that information. I recommend, especially female in the age of bearing child, having that test done to make sure you understand how your body handling it. Thank you, Angie. That's so sweet of you. I love that you enjoy the webinar. Dustin have a questions about, do you need an associate? I would love to get in touch with Dustin. Please send me a DM on Instagram. I love that. Yes, we do need associate. We're growing and we can keep up with the demand. Sonia asking, ozone therapy is very important in all dental diseases. It is very important. Yes, we see it every day, and we actually minimize and successfully helping patients to not have to face root canal when you are using the dental ozone therapy. Every time you open a tooth to help disinfect it, because if you think that your dental edge and things that you're doing every day can disinfecting completely when the environment is full of saliva and patient is alive and breathing, is really not possible to get a fully clean environment for bonding. Alexa asked, did you start out in general dentistry? Yes, I did. I started out in general dentistry, graduate San Antonio Dental School into 2010. Do you have any patient left the practice because I moved to wellness dentistry? Absolutely, Alexa. I have patients that don't value their health, don't understand what we're doing. They're just looking for the teeth cleaning. They're looking for, like a quick visit. Interesting story. When I transitioned to wellness dentistry in 2018, I have a couple, a husband and wife, left the practice, go somewhere else, and that's fine. We understand it's not the right fit. This year, the husband walked in the office because he tried to get into our office, but he could not. And he actually walked in, and I didn't know what's going on. So I asked, and his wife actually was diagnosed with Alzheimer's. And there's an Alzheimer treatment center in Houston, and his wife is a patient there. And they asked her to go see a wellness dentist. And my name was given out to them. They're asking her to come to go to our office to get a saliva test, to get the perio treatment under control because she have an advanced stage of Alzheimer. And so he realized that, oh, Dr. Katie practiced wellness dentistry, and our doctor refer his wife to us. And so he wanted to do a shortcut. He said, I'm a patient in your practice before. Can I just get in now and don't have to wait in line for 4 months? And the answer is no. You have to get back in line. You get out of the practice. We're happy to see you. If we have any opening, we get your wife in. But yes, patients don't understand, and that's okay. The value we offer, we want to serve the patient that value us also. And where do you send your saliva test? Yes, you can send it to Direct Diagnostic. Direct Diagnostic is the owner and the founder of the HR5. It's very similar to OrDNA. In the past, we used only OrDNA. The test costs a lot higher than the HR5. They do test for similar thing. So therefore, we are opt in for the HR5 because that way patient can have a test before the cleaning, after the cleaning, before the treatment, after the treatment. So we know the treatment's effective and their home care is effective because we do personalize the home care based on their result. So yes, you can contact Direct Diagnostic. If you tell them that you attend a webinar from Dr. Katie To, they will send you in your office free saliva tests so you know what in your saliva. Because I do believe that you need to understand your body in order to help other people. The next question said, have you had experience working with hospital with a protocol for low bacteria before patients are intubated? Yes, absolutely. We have patients that before transplant, we have patients that was sent to us before chemo, radiations, or surgery for cancer. We're in Houston, so it's a huge medical center here. And that's the reason why our practice are considered medical dental practice and not just a dental practice, because we understand the impact of the mouth to the rest of the body. To lower the risk of pneumonia, what happens show increased bacterial cavity? Yes, definitely. And you talk to medical provider, they understand the dangers of the bacteria in the system, right? They're changing from joint patient had to be having prophylaxis for the rest of their life. I mean, they find it in their issues after even 5 years after the knee or the hip replacement was done. So yeah, bacteria are dangerous no matter when or where that is. Well, possible to have access to your presentation? Yes, I believe that the Viva Learning having the copy of the presentation. So yes, Sherry, you can get that. Oh, Dawn, we miss you too. Holistic hygienist for 27 years. Yes, it's very different when you practice this way because patients really love and appreciate you. There's no age limit for treatment ozone. Please don't use ozone without training. Just like anything else, if you implement something new, you have to have training. And so we do have training for ozone, and there's no age limit. However, you have to have a good suction source, like a high-speed suctions going. I prefer to put oxygens on the nose so patient not breathing that in, because if your lung is asking for O2 and you having O3 in the air, is competing and is make the lung irritated. So ozone not supposed to go into the eye or the lung. So make sure that you have training before you are using or implementing any new procedure. In school, we learned that unethical to recommend, nope, we don't remove amalgam for toxic reason. We actually have patients get tested at the medical office, and then the medical doctor sent us the letter to having this removed if it's showing up as dangerous for the system, especially patients that dealing with autoimmune disease. And by the way, if you don't have conversation with these patients, they're miserable. They try everything, do everything. Their life quality get really bad. Same with Alzheimer patients, same with cancer patients. So if their bodies are toxic, and cancer is a disease of toxicity. So if their body cannot handle more toxicity, and this is the medical request, we do it. So honest question, honest answer. I think wellness dentistry not for everyone. However, if you don't make time for wellness, you will be forced to make time for illness. It's really sad that we see a lot of people running out of time when they go see us. They hope that getting out that root canals or getting out that mercury amalgam filling will help to save their life. But the story is no. It's a little bit too late. It's not just the amalgam filling. It's also what they've been putting on their body, amount of stress, They're not taking care of their body for so long, and now their body giving up on them. So no, Evans, I don't think that anything will be justified. It had to be a compound effort in this case. There are cases you recommend fluoride and some you don't. There's so many options, hydroxyapatite, iodine, and amylase. And so there's no need to go to the fluoride option when everywhere in the city are having water fluoridation. So it's really about understand what the patient exposure. If they already have the water fluoridation, if they're drinking Dr. Pepper, I'd rather them stop drinking Dr. Pepper and brush their teeth and floss their teeth. And what they're brushing with, for me, the toothpaste is more about getting the brushing experience more enjoyable. The brushings and how long they brush and they floss, they didn't water pick, more important than what toothpaste you use. What the name of the company I should receive a saliva test is called Direct Diagnostic. And if you type in saliva testing HR5, you will see the information there. Do you use fresh plate of membrane or fresh plate are sufficient? I'm not understand the question, so you can ask that again. Yes, follow Instagram, ask me questions, and I would love to answer more. I would love to show cases next time I get a chance. And everyone, thank you so much for your time. I love all the questions, and I promise if you send me a DM or an email, I'll answer all that too.